Welcome, everybody. The entire this whole room of people. So tonight we're going to be talking in another installment of the Outdoor Safety and First Aid lectures about first aid kits. So let's put in them, what we're looking for, and know where to get them. If you should build yours or not. So I put these disclaimers in every talk I do. This presentation is for educational or informational purposes only. It does not substitute professional medical advice. If you have any specific medical questions, ask your primary care provider. Before engaging in any exercise, fitness, diet, or nutrition routine that's new to you, talk with your doctor provider, especially if you're pregnant or have pre-existing conditions, and if I specifically name any companies or products, I do not have any financial affiliations with them. I wish I did, but
Gotta get on that.
I do. I absolutely do. Yeah. All right. Who's this guy? You all know who I am. For you out there in TV land, you don't know who I am. I'm a physician assistant for the past 15 years with a big interest in wilderness medicine. I have my fellowship in wilderness medicine. I also help teach for the Blue Ridge Adventure Medicine group down in Virginia from time to time. I hike all the time. I hike today. And I do some volunteering around the state as well with a couple of outdoor organizations that I've got National Forest and I was interested in. So, I wonder where that, oh, there we go. Slides are kind of out of order here. So what we're going to go over today is some of the considerations that you should take into thinking about what you should be packing in a first aid kit, specifically specifics remote related. What are the contents that we should be looking for? Kind of in a basic first aid kit. And then should we buy them? Should we make them? Should we like kind of Frankenstein them? We'll talk about that as well. So considerations. So this was a study that was done on AT hikers back in 2021 about some of the specific illnesses and injuries that they got on AT. And as you can see, as you look down through the list, cuts and scrapes and blisters kind of are 60%, foot pain 40, ankle sprain 17, dehydration, diarrhea, vomiting. You start seeing these like clusters of different medical issues that you might run into. Kind of the outlier here, Lyme disease pops up obviously, but any tick-borne illness will pop up. So these are kind of the things that I start thinking about with if I'm trying to create or look for a first aid kit. One thing that's not on here is allergies. That is actually pretty high as well. Another presentation I saw referenced some information from one of the Windows first aid courses that said about like 40% of people deal with allergies on the trail. So again, kind of the groups we're putting them into: soft tissue injuries, those are cuts, scrapes, blisters, your orthopedics, your sprains, strains, breaks, communicable diseases, gastrointestinal, and obviously tick-borne up here in New England, allergies, and then kind of the other category. Another consideration is distance and time. Are we going for just a 1.5 hour hike up Rattlesnake, or are we doing a multi-month Appalachian Trail hike? This is, this should look familiar to you. This is the start of the Appalachian Trail, the approach trail to Springer Mountain. Or is it somewhere in between? Are you doing an overnight? Are you doing a 5-hour hike? Now, some of the things you might want to carry more or less if you're going on a wicked long hike. You might want to carry just a couple band-aids if you're going for like a 10-minute walk down the road. Also, the seasons. Obviously during the summer, we're worried about things like bugs, heat, allergies. In the wintertime, bugs are in hell where they belong. But we also think about the cold injuries, the hypothermia, the frostbite. And then, especially in New England, fall. You can wake up and it's 20 degrees, and then at 2 o'clock it's 70 degrees. What do you do with that? So again, kind of the things you're starting to think about when things get a first aid kit. And then there's numbers. Are you going for a solo hike? Or are you going with a bunch of people? Maybe, if you're going with 5 or 6 or 20, should you all carry the same thing? Maybe you can split it up, so share the weight. Another thing to take into consideration. And then finally, your comfort or skills, obviously I'm way more comfortable doing medical stuff because that's my job. If you have training in medicine or even first aid, you might be able to do more than a band-aid, but you might not be looking at an ultrasound on top of Everest. So your comfort level also comes into it. I carry aspirin with me because if a person's having a heart attack, I will give them aspirin. But maybe if you don't know what to do in that situation, you don't want to carry around aspirin, just give it out to people. So that's something you should also reflect on as well as how comfortable am I. So again, just go as a summary: common illnesses and injuries, distance, time, season numbers, and distance. All right. So first aid kit contents. So we're going to do this kind of in that grouping of the most common injuries and illnesses. So your cuts, scrapes, and blisters. I always advocate for gloves. Gloves are not to protect the patient, this is to protect you, because there's a lot of stuff in blood that can hurt you, especially if it gets into you. Hand sanitizer also is in that same vein. Just cleanliness, protecting yourself, protect the patient, yourself first before the patient. Obviously then we start getting up into Band-Aids. We all know how to use Band-Aids. Gauze, pads, and tape for those bigger lacerations. Antibiotic ointment can be useful as well. Maybe not a big tube of it, but the little packets. And moleskin for all of those blisters and hot spots that we talked about. No, we haven't talked about that here. I talked about that with other people. Optional roll gauze, it's just kind of thicker gauze that comes in a roll that you can use to wrap, again, some of those bigger cuts and lacerations. Syringe for irrigation is pretty niche. You can just use a water bottle for that, honestly, but if you want to feel fancy on the trail, you can whip out a syringe. And tourniquets, I always carry a tourniquet. Again, this can definitely save a life if somebody's bleeding out, but if you came to my last talk, which I believe all of you did, you can make a tourniquet, so you don't necessarily have to buy one, but they make you look pretty cool if you have one, so there's always that. I should say, if anyone has any questions or comments, just feel free to yell it out. I'm not gonna shut you. Yes.
So quick question.
Yeah.
You mentioned prescription drugs. How would that work, say, if you found somebody in whatever state and for convenience sake, there was a bottle of prescription drugs next to them?
Yeah.
Is that something you wait for, emergency services or Good Samaritan Act?
So in that situation, unless you know exactly what that medicine's for and exactly how to give it, I would not touch it. I wouldn't even deal with that. There is one exception to that, and I'll talk about that in just a few slides.
Okay.
Yeah. So the orthopedic sprains and strains, your ACE wraps, they used to come with those stupid little like metal clips. Now they have Velcro, which is so much nicer. So you don't have to worry about finding those metal clips or having them pop off. Coban, this is that stretchy self-adhesive wrap. Usually you find it like animals coming from a vet will have those on. Those are really nice to have. Pain relievers, obviously, if you make sure you're able to take these, but like ibuprofen, Naproxen, and acetaminophen. See, I can pronounce acetaminophen. But those are the brand names if anyone's looking for that at the pharmacy. And then safety pins, they seem pretty simple, but safety pins are really helpful for making slings, pinning things together so you can like hang an arm if it's dislocated or broken. Optionally, the malleable splints. Actually, I didn't bring one. Yeah. These are called SAM splints. Usually you'll find these in like search and rescue kits for like ski patrol, but they're nice and moldable. They weigh practically nothing, and you can just splint an arm if it's broken. So these are actually pretty nice to get if you want to carry around an extra few ounces. Costs about $6 or $7 on Amazon. But I always have one of these. I just slip it right in the back of my backpack, and I barely even know it's there. And then cravat bandages. Anyone know what cravats are? Yeah, they're just triangle like cotton bandages. Like usually like the Boy Scouts use them. Like again, you can make slings, you can make tourniquets, you can make bandages. They're great little pieces of cloth. They usually come in these. Oh, I don't know if I have here. Oh, right here. I'm not going to take it out, but this is it's like muslin. It's pretty thin. I usually get these from the ski patrol guys. People are wrapped up in them from the ski mountain to keep legs and arms from moving while they get transported. Communicable diseases are a wonderful friend, the deer tick. Pretty important to get these suckers off as soon as possible. So tweezers are an absolute necessity. I'm sure there's some people who say they're optional. They're not in New England. Because as soon as you get a tick on you buried, you want to get that sucker off. Nausea, vomiting, and diarrhea is a little hard to treat in the backcountry. There are some things that you can bring. Pepto-Bismol is kind of the easiest one. It comes in tabs. I wouldn't carry around a big jug of Pepto-Bismol. It's a little heavy. You can optionally get Imodium. That's over the counter. That's actually pretty good for diarrhea. I usually tell people if you're puking or pooping your brains out in the backcountry, you should probably just get the heck out because you're going to get dehydrated pretty quick. Sure. And speaking of dehydration, electrolyte mix. There's a bunch of different ones out there. This one's called Scratch. This has sugar and sodium and potassium, magnesium. There's a few others like Element. Bouillon cubes are actually pretty good for electrolytes. They taste terrible, but if you need to replace like sodium or something, but you can also just get like some salt and sugar packets from like a convenience store, and you can throw that into water. Just make sure you taste more sweet than salt, and that's actually the recipe from the World Health Organization for like people with cholera and stuff. It's just sugar, salt, and water, because all you need is sodium in the grand scheme of things. And then alcohol wipes. There's a fun thing you can do with alcohol wipes. If you take a few of the, like 2 or 3, you open them, you put them in your hand while you're vomiting or nauseous, take a big old whiff. It actually can help with nausea. They use it in ERs right now. I haven't used it in the urgent care yet, but I'm going to at some point. What it does is it overwhelms the olfactory senses and actually distracts your body. It actually makes it so you're so focused on the burning sensation that you're less nauseous. Yeah. Allergies. So you were asking about like the prescription med.
Mhm.
This is really the only one I would sell or I would administer to somebody is an EpiPen. Anyone carry an EpiPen or ever had to give an EpiPen? You had to give an EpiPen. Okay. Yeah. So EpiPen, these are for those anaphylactic reactions. Usually out in the backcountry, it's going to be either to food or insects like bees and stuff. In retrospect, I probably should have brought a trainer, EpiPen trainer, so people could practice it, but I'll probably do that at a different talk. But yeah, EpiPens are kind of the ones that, if somebody's like blowing up and they are able to tell you they have an EpiPen, that's the only one I give because that's like life-saving. They're literally going to die if you don't give it to them. Yeah. Then you can get your antihistamines for, if you get some itching or sneezing or runny eye, runny nose, itchy eyes. I put the brand names and the generic names up here. They're all equally useful. You'll notice that Benadryl is not up here. We're kind of getting away from Benadryl in the medical community for like mild allergies because all of these work just as good. You only have to take them once or twice a day, and they don't have the drowsiness side effect or the dry mouth side effect or the urinary retention side effect or the potential dementia side effects. Like Benadryl is actually not that great of a drug. We used to use it a lot because it was the only thing, but now we have better ones. So although there is Benadryl in there, I need to get out of it. Optionally, you can get hydrocortisone cream, you can get Afterbite cream. They work okay. It's kind of putting sand against the tide. Like, if you're putting hydrocortisone cream on like a major poison ivy rash, it's not going to do much. But for like the minor things, like mosquito bites and stuff, they can be helpful. And then we have other. So waterproof bags are important because a lot of this stuff doesn't like to get wet. So for me personally, even though this first aid kit is waterproof, I still put it in a bag. This one is not, so I put it in a bigger bag. And also, waterproof bags can be really good as mouth barriers if you have to do CPR. It can be a waterproof barrier if you need to protect a cut from like water, if you're having to like go through a river to get out or something. Waterproof bags are very useful. Emergency blankets. I love emergency blankets. It's good for hypothermia. It's good for a tourniquet. It can be another barrier for wrapping, like a broken leg or something. Scissors. Scissors are really good, not only for cutting gauze, but good at getting at cuts. If someone has a cut kind of on their thigh, instead of having to pull their pants off, just cut their pants. We like to joke in emergency medicine, if nothing else, you can cut somebody's clothes off in an emergency. So, and then your prescribed meds. Obviously, if you are someone who is on medication that you have to take at a certain period of time, do not forget your meds. If you're going out for the day, I would put your medications with your first aid kit so all the medical stuff is together.
Yeah, I watched a YouTube video with a fish and game officer the other day, and he had mentioned bringing prescription meds on a hike. And that had never really occurred to me, but I'm on meds for diabetes that I have to take in the morning and the evening.
Yep.
It's like, if you get lost and you end up spending the night in the woods, it's like you go a night without your meds or even a day and a half without meds.
Exactly.
So it's like you should bring enough meds that in the event you get lost, you'd still have your meds with you to get you through. And I had never really thought about that.
Absolutely. Yeah. Yeah. And you're right. Like the people who take it in the morning and night, they're like, oh, take them in the morning before I leave, and I'll be back before the evening.
Right.
Not always.
Wrong.
Yep, absolutely. Yeah, and again, you don't have to bring your entire like big bag of pills. If you just get one of those little tiny pill dispensers with what you need for like that evening, you'll be all set. Yeah. The other optional stuff, the hand and body warmers, obviously this time of year can be kind of nice. Again, it's not going to cure you somebody of hypothermia, but it can help a little bit. Aloe vera gel for burns during the summer. First aid guide, if you're not up on first aid, they make smaller guides than this. Adam said this was one of the recent donations to the library. This was printed in 1972. So there might be some outdated stuff in here. You might want to get it out the one.
I'm almost would be fun. Be like, let's see what the craziest thing we can find.
I know there's bloodletting in there. So, but they sell like tiny pocket guides. Actually, this first aid kit that I bought came with like a little like guide that you have to get a magnifying glass to read. But it has. I should have brought that too. But it's good to have, especially if you're not like really like confident in some skills. Paper and pencil, that's really helpful to like jot things down about like when you do certain interventions, if you give medicine, if you're write down the time things happened, when certain symptoms started showing up. So this is really important for like the next level of care. You're, getting them to the ambulance or the hospital. So when you look at the list of what should go in a basic first aid kit, it seems pretty daunting, right? That's a lot of stuff. However, you don't have to carry like a box of gloves or like 50 Band-Aids. You're really only doing one, maybe two or three of any of these. So, most first aid kits, and again, we're going to get into them, most decent first aid kits will fit into something this small. And again, you're going to tailor it for how long are you going to be out, how many people are going to be with you. Again, if you're going on a hike for a few days with multiple people, split that up. Don't carry all that unless somebody else is carrying something heavier, then you definitely want to carry the first aid stuff. So yeah, this is a good list when you're looking at different first aid kits. Yes, sir.
So do you have multiple packs, or do you kind of like shuffle it around depending on what you're going to do or what you're planning on doing?
I personally carry the same stuff all the time, but that's because I'm prepared if something were to happen. I would recommend probably not shifting stuff around too much, just because you never know if you're going to forget something.
Right.
Again, if you just adhere to this, you're going to cover like 95% of the things that you're going to deal with. And then anything past that is just fluff.
Mm-hmm.
Yep.
Just trying to look fancy.
Yep. Yep. So, do we buy it or make it? So, it's kind of a silly question because like to make all, to buy all this stuff and make your own, it might get a little expensive, but you have backups if you're going to be replenishing it. So it's fun to make them from scratch, but that's my personal take on it. But it's a lot easier and cheaper if you just buy one and augment it from there. So I kind of started looking online at what are some of the first aid kits out there. I did buy one as well so people can see what's in that one, but they are all from Amazon because it's the easiest thing to look up what's in things. So this is the Rhino Rescue 1-person 1 to 2 day kit. It costs $17. And actually, so what are we seeing up here? So we have some antiseptic, these are antiseptic like iodine swabs, we have gauze, we have tape, we have moleskin, we have some band-aids, an emergency blanket, bonus points. They actually give you a tourniquet, which is interesting. Comes with a first aid book, so actually looks pretty good. What are some of the things we're missing from this first aid kit based on the list that we just talked about?
I don't see tweezers.
No tweezers, yep.
None of the pain relievers.
Yeah, some medications. Those are kind of the two big ones. I threw, electrolyte mix isn't in here. Antibiotic ointment, although these technically are like iodine swabs. So yeah, so we might want to throw maybe a couple, like a baggie of like Tylenol or ibuprofen in here, some tweezers, to kind of augment this for a personal first aid kit. All right, this is the Everlit 250-piece survival first aid kit, $40 on Amazon. All right, so it's got some really cool stuff. Like
Glow stick razor.
it's got glow sticks. It comes in this like paramilitary looking, like really tough looking bag. I can't remember. It's the military has it's like it's the modular kit, like the military.
Molly panel.
Yeah, molly panels. Yeah. Yeah. So it makes you look like you're about to jump out of a Black Hawk helicopter with your paracord bracelet.
Colors.
Right. Yep. Your paracord bracelet and your tactical flashlight. Your wallet multi-tool. But down here, what do we have? Obviously band-aids and tape and Travad, our triangular bandage, soap wipes, alcohol prep pads, scissors. You're going to look pretty tough and badass.
Still no tweezers.
Still no tweezers.
Oh wait, no, I lied. Never mind.
Where are they?
Next to the scissors.
Because they're
Oh, they are there. I was just at. They do have tweezers. Yeah, we don't have antibiotic ointment, no moleskin. This is not waterproof. So no waterproof bag. But you get a thermal blanket, your emergency blanket there, and a poncho. So you can look like Rainbow. And then finally, we have the Adventure Medical Kit. This is $42.49 on Amazon, or it was a few days ago. I couldn't find a picture, but these, in my opinion, they're one man's opinion, are actually probably the better ones out there. And the reason is it does give you medications. It gives you the tweezers, the safety pins. It gives you some duct tape. It has almost everything you need. The only thing it is missing is it doesn't have scissors. It doesn't have an emergency blanket. And no anti-diarrheal stuff. So that's kind of where you're missing here. But these actually, if you get these, you're going to be pretty well set. This is the 0.7, the 0.5. So this is a little bit smaller, but if you just look at the back, it has pretty much the same. Yeah, those are great. I actually really like those. They come in a couple different styles. This is also an Adventure Medical Kit, Mountain Series hiker at the Safari Eye on clearance. So again, like looking at all of these, you can kind of, with that list that we talked about at the end of what goes in them, kind of make sure that you're prepared and can kind of take stock of what are in these medical kits.
When I saw that one on the table when I got here, I'm like, oh, that's just part of the one we have.
No, I actually really like Adventure Medical Kits. If nothing else that they have, like the individual packets of medications. All right, so improvisations, doing some MacGyvering out in the wilderness. So you don't always have to carry all the stuff we talked about. Obviously you can just bring a good old fashioned duct tape, put it on around your pole, and that'll take care of your tape. Gauze, obviously you can use your clothing and bandanas. Splints, instead of carrying that thing around, sticks work just fine. Slings, if you were at my last one, the one before, we talked about making slings out of jackets and shirts. Tourniquets, we've also talked about that. And then one of my favorite is honey for antibacterial ointment. Honey has been used for thousands of years as an antibacterial substance. Actually, they still use it nowadays as modern wound care. So also helps if somebody's like having problem with their diabetes and their sugar's too low, or if they've run out of food, you can get honey. You can usually find these in like the little packets that look like ketchup packets at like the Common Man. I think they have them at the Common Man roadside. I've seen them at various convenience stores too. So just kind of take a couple of those and shove them in your pocket for your first aid kit. All right, and we shouldn't forget our furry friends. Dogs. There's cats and rabbits and stuff that go out on trail too, but mainly dogs. They can get hurt too. The good thing is, I'm not going to comment on like the medications. You should definitely ask your vet about that. But most of these items can be used obviously for pets. Couple extra things. The syringe for irrigation is really helpful for like if something's in their eye, if there's something stuck in their paw, so you can really kind of get in that crevice and give a little bit more pressure with irrigation. And then they do make these dog rescue harnesses. There's a few different ones. This one is Pack-a-Paw. It's made in New Hampshire. You do have to train your dog how to like not freak out in them, but this is actually something very useful. I actually do not have one, and I need to get one for my dog. But if you do have a dog, you should probably have some sort of way to carry them out if they get injured. And lastly, what I'm going to say is, remember, if you use your first aid kit, make a note, put it in your phone or something to replace what you used. All right, because you don't want to be shorthanded the next time that you go out onto the trail and you have the same injury and you're like, oh, I used that gauze the last time, or oh, where are my tweezers? That's it. Kind of a shorter one this time. Yep. But any questions?
So how do you know when something in the pack has gone bad or is
So the only thing you really have to worry about is the medications in terms of expiration, and the expiration will actually be right on there. Like this expired last August. So I need to replace those. Sometimes the alcohol prep pads will dry out, so that's the only like thing that goes bad. All the other stuff in here is not really sterile, so you don't really have to worry about replacing things. And the medication is probably still good. It's just might not be as efficacious.
Yeah.
Cool. Mm-hmm. Any questions from the very large audience we have here that you can't see at home?
standing room only?
That's right. They're just very quiet. Yeah. All right. Well, that's my presentation.
Thank you.
Yeah. Adam, you'll add in the like roar of the crowd.
Yeah, we'll pan over to the audience.
To like move to different.
Yeah, there you go, yeah.